Thank you very much, Jean. Dear colleagues in the panel, dear colleagues in the audience, I would like to thank, first of all, for the invitation to talk about Sustainable Development Goals. I think some speakers have already talked about this. It's very important that we know about those Sustainable Development Goals and acknowledge that air pollution is unfortunately not mentioned in those development goals. So we know very briefly, this is a summary and I will not go into the details, about 1 billion people suffer from chronic respiratory diseases globally, and this includes asthma, respiratory allergies, COPD, occupational lung diseases, etc. And CRDs account for about 5 million deaths annually globally, and COPD is to become the third leading cause of death by 2030. And as mentioned before by several speakers, indoor air pollution kills more than 4 million people each year. The top 10 causes of death from the environment, not surprisingly, it's stroke, ischemic heart disease, unintentional injuries, cancers, and on the fifth position, chronic respiratory diseases. So it's very important that we keep this in mind when we talk about the influence of environment on health. Recent studies of the World Bank and the Institute for Health Metrics and Evaluation have clearly outlined that air pollution was responsible for about 5.5 million deaths in 2013, and this is critical to know in order to change policies around the globe, including in Europe, of course. Environmental impacts on health are, of course, caused by different causes, such as household air pollution, ambient air pollution, occupational risks, and secondhand smoke. Very importantly, we have to really not forget tobacco as one of the major risk factors for health. The Sustainable Development Goals, there are 17 of them, really look at several issues that look at well-being, and goal number 3 and goal number L11 mention air pollution, but we don't have a specific goal for air pollution. In my opinion, this is a mistake. Therefore, it's really important that we advocate for air pollution when we talk about the sustainable goals and the 2030 agenda. It's critical that this is being taken into account. As mentioned before, the WHO focuses on the reduction in mortality. This is specified in target 3.4 to reduce mortality, premature mortality from NCDs by 30% by the year 2030, and other targets really look at several risk factors such as alcohol use, tobacco use, etc. But air pollution does not feature really prominently. So we need to make sure that a specific goal even if a specific goal on air pollution does not exist or is not being really pushed in the SDG agenda, that we really highlight that air pollution is linked to almost all SDG goals. This is very important. Air pollution and children, I think it was also mentioned by a previous speaker, can seriously affect the health of the fetus. Children's lungs are in the process of growing and developing, and air pollution can really have an impact on their development. Effects of air pollution can impair the development of children's lungs, and poor children are mostly at risk. A lack of adequate health services and poor initial health makes the poor children more at risk, so the reduction of air pollution is one of the most important things that we can do for children, and it's important as an advocacy tool because very often we pay more attention when children are affected. There are a lot of benefits for tackling air pollution. I think this is also very important. It's if we want to reduce premature deaths from several NCDs such as stroke, ischemic heart disease, COPD, etc., we need to tackle air pollution. reduction of hospitalizations due to CRDs in children and the elderly are very often due to pneumonia, bronchitis, and asthma, etc., and air pollution can affect all those areas. There's also an economic benefit, very important. When we talk about health, very often it's the Minister of Finance who has a lot to say, and therefore we need to make sure that it is understood that if we tackle air pollution, there's a benefit. So for China, the World Bank has actually estimated that by introducing air pollution measures, you can actually reduce the costs of healthcare projects by $125 billion in this 10-year period. And the benefits to cost ratio for reducing air pollution is 4:1. So it's really very important for countries to invest in air pollution mitigation in order to also improve health globally. I think a very positive sign is that the WHO, in its 13th global program of work, which goes from 2019 to 2023, has actually envisaged to really scale up its efforts to prevent air pollution related disease. And obviously the link between air pollution and NCDs is going to play hopefully an important role. You can probably not read this slide, but and I will not go into the detail, but in this slide you can see that each goal can actually contribute to air pollution through cleaner environments, by growing food which is non-contaminated and so on. So pollution really affects all the different SDGs, and we can act upon them. As mentioned by Dr. Nikolai Kaltaev, the Global Alliance Against Chronic Respiratory Diseases really is very interested and committed to tackle air pollution and climate change through different activities. And for 2018 and 2019, the GARD has actually decided to emphasize its work on climate change and also on air pollution. And in this period, GARD will advocate for tackling air pollution and climate change through supporting innovative projects such as POLAR, the project that will probably be discussed later on looking at the effects of air pollution on allergic rhinitis and asthma and airway diseases in general. By publication of a GARD report which will tackle also or dwell with air pollution and climate change, and at side meetings at global and regional high-level events to really make sure that air pollution and climate change is being mentioned and not forgotten in the deliberations. There are several GARD demonstration projects which really are critical for global health in terms of showing that really things can be done. It's the Finnish Asthma and Allergy Program, the AREA project on allergic rhinitis and asthma, the Practical Approach to Care Kit developed in South Africa, and as I mentioned, POLAR, an important project that is in development that will could become a very important sentinel project and excellent advocacy tool to increase and support reduction of air pollution in support of the SDG goal number 3, SDG goal number 11, and of course several other SDG goals. Thank you very much.